Hello, I'm Michael Furstenberg. I'm a heart surgeon at the Ohio State University Medical Center. I'm very excited about the results of the BRIDGE trial published in the Journal of the American Medical Association, for which I am a co-author. This study was very exciting in that we demonstrated the effectiveness of a new antiplatelet agent for patients that are requiring antiplatelet medications prior to cardiac surgery. Antiplatelet drugs remain the cornerstone of preventing clotting complications in patients with severe coronary places the patients at considerable risk for having recurrence of their symptoms. Conversely, continuing on with these medications up until the time of surgery places patients at risk for bleeding and bleeding-related complications. The major findings of this study, which I think are quite impressive, is that by continuing on with this IV medication up until the time of surgery, we were able to effectively inhibit platelet function up until the time of surgery by when we turned off the drug and those patients then had normal platelet function and were able to reduce the risk of bleeding and bleeding complications. The impact on cardiac surgery is huge, but I'm more excited about the potential reduced bleeding and clotting complications in those patients having other surgical procedures as well.
What are some of the other limitations that you see when you're using what we call a monotherapy drug-eluting stent?
Well, I'm not sure that it is a limitation, but I think what we do know is that, stents have really improved a lot. We are not where we were a decade ago with the first generation drug-eluting stents, and we have to be very open and honest about that. We have done very, very well. We've reduced complications, but we still have this obligatory 12-month antiplatelet, dual antiplatelet therapy. But as our stents have improved, there is this possibility of reducing and shortening the duration of dual antiplatelet therapy. And I can see of no other better place to do this than a combination therapy stent, which would be the combo stent.